differently. This is not like anything I've ever seen. Is this? Am I getting the right picture? Have zoos really changed?
Absolutely. There's been, over the past roughly 25 years, there's been a true revolution in zoos where we've moved away from menageries, which I have to agree with you, there was some exploitation of animals, to organizations that are seriously committed to conservation. And we do this in several ways. One is, of course, education of our local public. And you don't learn much from seeing animals pacing back and forth behind iron bars. But in the new exhibits, you have the opportunity to feel for the animal, to empathize, to connect, to learn about it. Secondly, zoos have been active in breeding animals as a backup, if you will, to disappearing wild populations, and in some cases, reintroducing them to the wild. Third thing is training. We've become training grounds for wildlife managers. And fourth, the techniques that we have been developing for years and years in zoos, such as assisted reproduction, veterinary care, are becoming more and more applicable to wild animals as the wild, as national parks protected areas, become more and more zoo-like. The difference between the wild and the zoo is disappearing.
Uncle somebody going to come from? Does anybody remember what state in the United States? Alex?
Washington.
Washington. Now, there are two Washingtons. Do you know the difference between the two Washingtons?
Yes, the one farthest away.
Okay, and what's that
Third
one?
grade, and there's so much to learn.
Just Washington. Okay, if I pull down the map of the United
Geography is just one of the subjects 10-year-olds have to master.
First of all,
And Alex is pretty good at it, as he is at most things in school, from art to arithmetic.
That is Washington State.
He's also got a knack for how things work, so he can help 8-year-old Jimmy get the hang of driving. But it's not geography or mechanics that's brought these kids to Newark, New Jersey.
Nowadays, soccer balls, as well as the balls used in some other sports, are often
They've come to take part in a reading study in this laboratory at Rutgers University. Jimmy is flying through a standardized passage from a first-grade storybook.
Have always been made from leather panels stitched together around a rubber bladder. The balls used by professionals
But Alex is not having such an easy time.
have always been made from leather planes.
Though 2 years older, Alex can't keep up with Jimmy in reading.
Rubber blubber?
Close. What's that letter?
When an otherwise intelligent child falls 2 or more years behind in reading level, most specialists agree on a possible diagnosis: dyslexia.
Ladder.
Great. Okay, now I want you to read some words that are not real words. Okay, instead just tell me how they sound. How does this first
One strategy dyslexic kids often use is guessing at words. Watch Alex try that in this nonsense test.
See. Scattered. Chad.
You made that into a real word. Let's look at that one a little closer, okay?
Scratched.
Scattered and scratched are shrewd guesses. Alex is playing off the consonants in the nonsense word, and he gamely keeps trying.
Stretched. Stressed.
Exactly what dyslexia really is has been fiercely debated. Paula Talal's work here at Rutgers is helping make this murky label more precise.
What they're having trouble with many times is reversals of letters, or what appears to be reversals of letters, like B's for D's or G's for P's. Well, it's really interesting. It turns out that those are also the same letters that are the most acoustically confusable along a very important dimension.
Pa. Ba.
When we speak, we create sound waves, and a computer can convert them into pictures.
Pa.
Looks like this.
Ba.
Like this. You can see they're the same except for this short stretch at the beginning. Just a few hundred milliseconds of sound. Paula's theory is that sound changes this brief are too fast for dyslexic people to pick up on. So she's testing kids' ability to recognize sound changes. Jimmy can remember 4 tones and press the corresponding buttons, even when the beeps are played quickly. But with just 2 tones, Alex is uncertain.
Okay, this one's a little tough. Your turn.
Oh no. Oops, that was supposed to be that one.
Trouble. And to prove that Alex's problem isn't just hearing, Paula switches to another medium, visual symbols. Alex still can't do it. The relationship between this string of symbols and his button pushing is almost random. Paula's results are clear and consistent. When information is presented too quickly, her dyslexic subjects just can't keep up.
The language and learning impaired kids had just as much trouble visually as they did auditorily. So the problem seems to be a specific problem that has to do with the rate at which the nervous system can transmit information that keeps coming at it one after the other.
I'm going to just go into the room and just try to watch the IV, but sit down.
At the National Institutes of Health in Bethesda, Judy Rumsey is investigating the physical side of this brain processing problem.
Your head on this.
Charles is about to undergo a positron scan.
I want you to just hold still and close your eyes for the next couple of minutes.
It's a painless procedure that allows Judy to study what goes on inside his brain while he listens and responds to a quiz.
This feels a little funny at first, but it'll be comfortable after.
Instead of tones or symbols, Judy uses actual words, but she's still testing how information is processed.
Okay, we'll begin the scan in just a minute. Now you'll be hearing pairs of unrelated words, and if the 2 words within a pair rhyme, you should press the button as soon as you know that they rhyme. Paul, ready for the injection.
As the scan begins, a radioactive tracer in this solution will make things more visible.
Relate. Iodine, serpentine. Improvement, percolate. Degrade, cascade. Bent, wheat. Vindicate, penetrate. Hesitate, dissipate. Deviate, permanent. Lace, pace.
It's not
Salivate,
poetry,
cabinet.
but it does the job.
Lake, break.
As Charles listens to each pair and responds to rhymes,
Caliber.
the scanner captures successive pictures of the blood flow through his
Wave,
brain.
made.
Judy
Frustrate,
zeroes in on the
translate.
areas responsible for language processing.
Defeat, concrete.
It turns out that some of these brain areas are not active in dyslexic people.
Invent, lament.
This is an area in the left parietal lobe important for language processing, and as you can see here on the right in our normal control, there's considerable blood flow and considerable neuronal activity. On this scan, we see the same slice through the brain of one of our dyslexic subjects. There's less activity as indicated by the cooler colors here, and the fact that there's less of the warm colors, the red and orange in particular, in this dyslexic brain. This means that dyslexics are unable to actually activate this region that normals activate in order to do the rhyme detection task.
So the evidence is mounting. Dyslexia may be an organic, even perhaps a genetic, disability. That's why the Rutgers lab is now exploring early detection, playing tone cues to babies, and measuring their response time.
Scene 1 says the setting is the imperial.
Early diagnosis will help, but if dyslexia really is a physical disability, Sustained and supportive teaching will remain the only way to help these bright kids become successful readers.
My perfect garden will be perfect no longer. How trouble.
How terrible.
How terrible.
You know, I really identify with Alex because I think I'm at least mildly dyslexic. When I was growing up, everyone else in my family really enjoyed reading, while I was struggling with it. The reason that struggle was so frustrating is that we just didn't understand it. If I had been trying to learn something visible, like how to juggle, everyone would have understood. While I could get one toss at a time, I just couldn't put it all together. But if you have a good teacher and supportive people around you, even things that seem impossible can happen.
On the eve of the 21st century, medicine, along with the rest of society, is being transformed by the computer. At the heart of every story we'll be doing in this episode is the computer's ability to process vast amounts of information. In the operation being performed here today, the critical information is the exact location of a brain tumor that's threatening the life of a young woman named Linda Tolby. Without that information, the operation that's about to begin, and through which Linda will be awake, may not even have been attempted, leaving her 2 years to live. It's a few days after the East Coast's blizzard of '96. Linda, her fiancé, and parents have journeyed from New Jersey to Boston's Brigham and Women's Hospital. For 8 months, Linda has had daily seizures from a tumor that's slowly pushing into the part of her brain that controls movement and feeling.
When I found out the tumor was growing, the doctors in New York did not want to touch the tumor, so I wrote to Dr. Black, and he told me to come on up, and he said with his new technique that he could do it. And that's when we came up here, and that's what we're here now for.
So your trip was okay?
Yeah,
I hear you.
Neurosurgeon Peter Black is ready to take on Linda's case because of a powerful new technique for peering into her brain.
It's a very interesting process. I think you'll like seeing how it works.
The process begins with what is now a standard technique for scanning the brain: magnetic resonance imaging. The MRI makes cross-sectional pictures of Linda's brain, and in separate scans also locates its major blood vessels. The information is combined and processed to create a three-dimensional image of Linda's head, revealing the brain inside. This technique has been pioneered at Brigham's Radiology Department as part of an ambitious program to give physicians unprecedented power to see inside their patients, both before and during surgery. In Linda's virtual brain, the veins are colored blue, and the tumor, located in the region that controls her ability to move her body, is marked in green.
My biggest fear in having surgery is that I might become paralyzed and not be able to walk. That's my biggest fear.
This fear that cutting out the tumor will damage her motor skills lies behind another innovative test.
Okay, ready?
An attempt to pinpoint her brain's motor region with the aid of a magnetic wand.
5, 4, 3, 2, 1, go. Okay.
Placed on her skull, the wand stimulates the brain beneath. In this case, they're searching for the spot that controls movement in her left hand.
1.
Good response.
5.
By moving the wand and tracking its location with flashing lights, Linda's motor region is precisely located.
Okay, very good, Linda. We found the motor strip, huh? We're all done. Peter says this is where the tumor is pushing down somatosensory cortex. Right.
This is the first time this method of mapping the brain has been used here, and an eager crowd of researchers awaits the results.
And if you start going down towards where the ear would normally be, you see a little red spot, which is almost slightly off center on this little strip of cortex. Yep. So it's gorgeous.
The day before Linda's surgery, I shared the remarkable experience of seeing inside her head with the help of 3D glasses. Is this the first time you've seen this 3D picture of your brain?
Yeah, it's amazing.
Oh, thank you.
It's amazing.
The 3D image, plus the mapping of the motor strip, gives Peter Black much more insight into what he will face tomorrow. So this is helpful in making sure you don't invade that motor area, right?
This tells us that it's reasonable to go ahead, assuming that the tumor is now behind the motor strip and not in it. If it were in it, we would say this would not be a possible operation.
So this gives you a chance to know whether or not to do the procedure, and then it also guides you during the procedure so that you don't hurt. Are there any other parts of the brain, or like blood vessels or something, this will guide you in?
Yes, I think that the two other important areas, one are the veins, which are extremely important not to injure, and we know where they are now. And the second is the fact that the tumor itself appears to be in the sensation area of the brain. And the question of what implications that has for Linda's recovery after the surgery are fairly important.
Something amazing. Thank you very much.
Good thing you did your homework, Wanda.
I did my homework. Dr. Black did his homework.
8 a.m. on the day of the surgery. Linda is sedated but awake, her head uncomfortably clamped at the best angle for getting at the tumor. When I saw you yesterday, I thought you had a tremendous amount of courage, and I still see it in you. I see you riding this. By this point in the surgery, a piece of Linda's skull has already been removed and her brain exposed. A video camera has been set up to peer over the surgeon's shoulders. It's now that the computer image of Linda's brain puts in an almost magical appearance. There, okay, I see that. Nice start. Because by carefully aligning the virtual brain with the real one, the tumor's location is revealed. Can you see the tumor yet?
Yes, it's right exactly where we had predicted that it would be. The only area that I am not sure about is an area that we thought was motor strip, and the question is, does the tumor impinge on that? And we'll be testing that in about 1 minute. Linda, we want now to test your movement, okay, hon? And you're doing great. Everything's going very well. We see the tumor, no question about that. And it looks like it's going to be removable, but we want to just check some of the things about movement and feeling. I want you to tell me now if there's any movement in your hand or your arm on the left side, okay?
Yep. Got it.
Perfect. I mean, right on. This is exactly where they found movement yesterday, by the way, with the mag stim. And so let's try 4 here. Linda, tingling where, hon?
What did you feel, Linda?
Tingling, and her thumb moved.
Tingling in her thumb.
Wonderful. Linda, this is very good news in terms of what we can do here. Nothing?
The testing confirms that the motor strip is next to the tumor, but separate from it.
This is great.
But now there's another concern. The tumor seems to occupy a spot that normally would allow Linda to feel sensation in the left side of her body.
We're now stimulating her wrist.
Yeah.
And that stimulus is being picked up by that grid.
So each of those locations has a number on it, so you can tell
Exactly
if the stimulation at the hand is being picked up under a number, you know exactly what part of the brain is receiving that stimulation.
Exactly.
If you found that the tumor was receiving signals, what would that do to the operation?
Well, this would be a situation we'd talk with Linda a little about. We talked before the surgery about that issue, and she said she'd rather have as much tumor taken out as possible, even if it ended up with some trouble with sensation for a month or 2.
Linda's wrist is stimulated. You feel anything, Linda, in your thumb, in your hand? An electric shock.
Okay, we're going to go with that, Peter.
The fact that you're getting this typical pattern on every part of the grid, none of it's on the tumor probably, yeah?
No, I think we're probably below the tumor.
Below the tumor. As they move the grid around, they get more good news.
There's no phase reversal with where you have your grid.
The tumor doesn't seem to be receiving signals when Linda's wrist is stimulated.
Yes.
He was very excited when he got that report of what areas were stimulated because it seemed to be exactly what he hoped it would be.
I want to help you with Dr. Black.
Yeah.
Moving to the right side, take that.
she'll have a complete resection without any weakness after the surgery.
Yeah.
So we're really all very excited about that.
I went to a lot of doctors, a lot of hospitals, and nobody refused to do this kind of operation. So it could be done. That's why when Dr. Black went to the television, I didn't have a problem because he helped a lot of other people. You know?
Yeah.
To help one more other person besides me would be great. Like you said, 2-3 years ago, people were having this kind of operation.
It's really a team approach, as you can see.
I have to show you something here when you have
Okay, I'm coming over. It's now about 2 hours since the operation began.
We outlined the tumor here in blue, but you see how it's lifting itself out now? Almost, it's really bulging out of the rest of the brain on its own. Dramatic. Okay, so that's the first part of tumor that we've just taken out. Can go to
How much of the tumor do you think that
That's
is?
about a quarter to a third.
Peter Black now switches to an instrument that first breaks up tissue with ultrasound, then sucks the scraps away.